nothing better. What the hell up is for me? Think away before you waste in front of time. It's all by your side. You got it to do life better. 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 I see you at the movies. I see you with your lipstick on. I'm looking out for cosmos. I'm hoping that we'll get along. It's time for an ovation. It's time for us to make a change. It's time for a Chinese New Year. It's time for me to make a way. Then I can't wait to get far from here.
Hello, everyone. Thank you for being in attendance tonight. My name is Angela Cáceres. I am the Health and Wellness Program Director here at Central Valley Scholars. I use she, her pronouns, and I will be introducing the presentation for tonight, which is by our queer health scholar, Robert Rosales, who uses he, him pronouns, presenting on awareness and accessibility of pre-exposure prophylaxis, or PrEP, in Fresno County. So, before we get started, I'd like to introduce the org a little bit. So we are called Central Valley Scholars, an educational nonprofit representing the Central Valley, centered in community, accessibility, and environmental responsibility. We support undergraduates, graduate students, high school students, and more. You can find out more about the organization at centralvalleyscholars.org. Also check out our social medias, including Instagram, Facebook, and LinkedIn. And without further ado, I will hand it over to Robert to get us started for tonight.
Good evening, everyone. As Angie introduced me, I'm Robert, and my pronouns are he, him. I am from Fresno, California, and I currently attend Fresno State, where I'm pursuing a bachelor's degree in psychology. And my topic within the Community Health Scholars Program was queer health, and I decided to delve deeper into examining the awareness and accessibility of PrEP among queer men, transgender women, and gender non-binary individuals who reside in Fresno County. So my interest in the topic comes from being a queer person myself and living in the Central Valley, and as well as being a peer sexual health educator. At the moment, I do not have a definite career aspiration, although I do definitely want to work in community health, specifically mental health, whether it be through direct patient care and or policy work. Sorry, there we go. Okay, is that the right slide? Yeah, oh well. Okay, so before I start, I want to do some brief acknowledgements. I want to thank my primary care physician. I could not obtain her email to ask her if I could name her, but I want to thank her since she was the one who got me on PrEP. She was the one who provided me with patient education on the side effects, on the purpose and the significance of PrEP as a biomedical intervention in HIV prevention. And as well as providing me with the statistics regarding sexually transmitted infections and HIV in Fresno County. So I want to thank her. I also want to thank Angie Cáceres. I don't know why I forgot to include her. Sorry. She has been super supportive and just all around an amazing person throughout this entire process. So I want to thank her as well. I want to thank Central Valley Scholars for providing me with a medium and where I could conduct research on a topic that's has been of an interest to me. I also want to thank Jennifer Cruz and Tony Harrison. Jennifer Cruz from Fresno EOC, and Tony Harrison, who works with HIV positive folks, who provided me with the different perspectives on HIV prevention and queer health issues. I also want to thank David Budavong and Nico Lara from Fresno Barrios Unidos, although I heard David Budavong is no longer with Fresno Barrios. And I also want to thank Keeping It Sexually Safer, which is the program that I am under in, since they instilled this harm reduction approach within me that I have used in throughout my project and my survey, and as well as how I'll use it within my future career as well. So I want to acknowledge all of those individuals and organizations for helping me in my journey with this project. There we go. Okay, so some goals of this presentation. I had 3 main objectives with my survey. And I did this through utilizing an inductive approach and as well as a branch logic design. So the first objective was to identify how many individuals were aware of PrEP, and I measured this through 2 items. One item was a simple yes or no, and it just asked individuals if they ever heard of PrEP before. And if they answered yes, they moved on to the next section, which showed a series of items with 1 item in regards to knowledge on PrEP. The second objective was to identify how many individuals at the time of the survey were on PrEP, and this was a simple yes or no item as well. And I used the branch logic design again. And if they answered no to not being on PrEP, then they moved to the next section where they were asked reasons as to why they're not on PrEP. And the overall goal of this presentation is just to provide recommendations and a potential outreach project in response to the responses that I got from the survey, and as well as to HIV prevention as well. Okay. So what is PrEP? Pre-exposure prophylaxis, or PrEP, is a daily medication used to prevent HIV infection in individuals whose behaviors put them at risk of contracting HIV. So PrEP is recommended for individuals who may have an HIV positive partner, consistently do not use a condom during sex, have multiple sexual partners, inject drugs, and what's the other one? Or have been recently diagnosed with a sexually transmitted infection, or STI, in the past 6 months. Those individuals would benefit from taking PrEP. I also want to add that there's another method that doesn't have to be taken daily. It's known as on-demand PrEP, or the 2-1-1 method. And in this regimen, individuals take 2 doses at least 2 hours before their sexual encounter, with 1 dose for the next 2 days. And this method has also shown high efficacy in reducing HIV transmission during anal sex. And this could benefit individuals who may have sporadic sexual behavior. Maybe they can't afford to take daily PrEP, or they just don't like the idea of taking a medicine daily. So that's another viable method. So furthermore, PrEP is a combination of 2 drugs, amitriptyline and tenofovir, and when used appropriately, it can reduce the transmission of HIV during sex by more than 90% in HIV negative persons. Currently, there are 2 brands approved by the FDA for PrEP, Descovy and Truvada. Descovy was released or was approved back in October 2019, and Truvada has been available since 2012. The only caveat with Descovy is that it's only recommended for cisgender gay and bisexual men, transgender women, and gender non-binary individuals who were born with the penis, just because there's insufficient clinical data suggesting the efficacy among cisgender women, transgender men, and gender non-binary individuals who were born with the vagina. On the upside, Descovy does have minimal effects on the body when compared to Truvada, and is a better option for those who may have osteoporosis or kidney issues. And in the case, Truvada wouldn't be the best option. However, Truvada is available to everyone regardless of their sex, and is also beneficial for individuals who inject drugs. Okay, so on to the literature review. So the reason why I decided to focus on these 3 main identities was because of local and national data. In 2017, 78% of the new HIV cases in Fresno County were exclusively from men who have sex with men, with an additional 5% of men who have sex with men and also inject drugs. There was a 2019 systematic review and meta-analysis that estimated that 14% of all US transgender women live with HIV, and HIV data on gender non-binary individuals is not readily available. And for that reason, I decided to be inclusive of transgender women and gender non-binary individuals, since HIV research and prevention efforts tend to focus on men who have sex with men. I mean, and for good reason, since they have been disproportionately impacted by the HIV epidemic. But transgender women and gender non-binary individuals also face an additional set of barriers when compared to cisgender gay and bisexual men, such as survival sex work, conflation with MSM, which means that their struggles are grouped with cisgender gay and bisexual men, and non-inclusivity. As I mentioned, the HIV research and prevention tends just to focus on cisgender gay and bisexual men. Okay, so continuing with the literature review. So this slide is measuring or examining awareness and uptake of PrEP. So between 2014 and 2017, awareness of PrEP among US MSM increased from 60% to 90%. And there was also an increase in the uptake of PrEP from 6% to 35% among these MSM. Some data suggests that 35% of all US transgender women are familiar with PrEP, yet only 2% of them are on it. And as I mentioned, there's no national data regarding gender non-binary individuals. But in one qualitative study that I reviewed, 54% of gender non-binary youth have heard of PrEP before, but none of them indicated that they were on it. So that was another reason why I decided to be inclusive of those 2 identities, transgender women and gender non-binary individuals. Okay, so on to the last slide, literature review. This slide is focusing on the reasons and barriers for the non-uptake of PrEP. So in one study, 6 key factors influenced the interest in PrEP uptake, and it was access to ongoing healthcare. And this is in reference to how PrEP has to be, if you're going to be on PrEP, you have to be tested every 3 months. for STIs, and as well as lab and kidney work, or just to determine if there hasn't been a decline in your kidney and liver function. And as well as sexual risk assessment, whether individuals were cognizant of their own risk when it came to acquiring HIV, knowledge of side effects, so if they were cognizant of accurate potential side effects of PrEP, the perceived efficacy of PrEP, whether they believe that PrEP would benefit them, perception of their medication adherence, whether they believe that they would follow their appropriate regimen when on PrEP, and the cost of PrEP as well. And obviously not every MSM has to be on PrEP or should be on PrEP, but it's estimated that 46% of US MSM in the age range of 15 to 65 years are potential PrEP candidates. Another statistic that I used for the social, cultural, and structural barriers for the non-uptake of PrEP was after finding out that 30% of US MSM live in PrEP deserts. And PrEP deserts can be classified as geographical areas where the nearest PrEP clinic or PrEP provider is from more than a 30-minute one-way drive. And I decided to include that as well, since, given the fact that Fresno County does encompass rural communities as well. And the last statistic was a 2015 survey indicated that 1 in 3 doctors and nurses have never heard of PrEP before. And this can also contribute to PrEP deserts as well. I actually talked to a clinician, and he indicated that PrEP, when compared to other stuff he learned in medical school, isn't as complex or complicated to learn. So it all just comes down to whether an individual or the clinician, the doctor, is willing to learn how to prescribe PrEP. So that I thought that was interesting as well. Okay, so then going on to the participant characteristics. So I initially had 71 responses, but I had to remove 2 due to being repeated, a couple more for incomplete responses on the gender identity and residence item, and then a few others for not residing within Fresno County, although in retrospect, I could have been inclusive of the entire Central Valley, and that's something future research could examine. So the gender breakdown, a majority of the participants at 70% identified as men, with the least represented being transgender women at 3%. 73% of the participants indicated they lived in Fresno, then followed by Clovis and Sanger, and then 1 for each Carruthers and Kerman, and an unspecified location. Oh, and then the average age of the sample was around 28 years old. Okay, so other participant characteristics. So the pie chart demonstrates the racial breakdown of the sample, with the majority identifying as white. A majority of the participants at 59% indicated they were Latinx, and most individuals reported being on private insurance at 49%. Okay, so on to the results. As I said, there was 2 items that measured PrEP awareness. 1 item was a simple yes or no if they ever heard of PrEP before, and 83% of all participants have heard of PrEP. And when you look at the gender breakdown, a majority of the participants have also indicated, regardless of gender, that they have heard of PrEP, with 69% of gender non-binary individuals hearing of PrEP, 88% for MSM, and all of the transgender women have heard of PrEP as well. And then for the item measuring the knowledge regarding PrEP, most participants indicated a basic understanding of the overall purpose of PrEP, which is to reduce HIV infection. Although there was 2 individuals who had some misconceptions. One thought it was a vaccine, and another individual thought it was ART, which is antiretroviral therapy. And he is correct, but the purpose of PrEP is for HIV negative people, negative persons. So, Truvada and Descovy was used, or is still used for as ART, but he was incorrect because PrEP is intended for HIV negative people, negative persons. So some example quotes of participants' knowledge are listed down below. An individual stated, "It helps lessen the risk of contracting HIV, but doesn't replace condoms or any other protectives." And that is true. It's only intended for HIV prevention. It protects against HIV, but not any other STIs. And that's also true, as I said, it's only intended for HIV. So that's why it's imperative to still use a condom to reduce getting infected by other sexually transmitted infections. And this individual possessed a greater depth of knowledge regarding PrEP. It is a pre-exposure prophylaxis used to prevent HIV in people who currently are not infected. People who are infected cannot take PrEP. It is expensive without insurance. STI and HIV testing is required every 3 months, and it can also be expensive without insurance. The medicine can affect your kidneys and bones, so screening for these side effects is important. So PrEP, I think the price tag for PrEP without insurance is, I think, $1,000, more than $1,000. However, California, compared to other states, has made great strides in increasing access to PrEP. California's state Medicaid program, known as Medi-Cal, covers the entire cost of PrEP. They also have an initiative known as PrEP AP for those who are low income and don't qualify for Medi-Cal, where they can receive a subsidized price tag of PrEP that covers either the entire or a partial cost of PrEP, and as well as the medical related services associated with PrEP. I can't speak on the side effects that well because I'm not a clinician. So, but Descovy, as I said, is a better option for individuals who may have osteoporosis or kidney issues, because Truvada has, there have been some studies found for those who do have kidney issues that it has shown a decline in the eGFR, which is the estimated glomerular filtration rate, which is responsible for clearing up creatinine, a waste product that the body produces. So that was examining awareness of the participants. Okay. Furthermore, I had one item asking individuals where they heard of PrEP, and the most common source of PrEP was from social media. As I was interpreting the data as well, I noticed that 59% of the sources were digital mediums. So, social media, online dating apps such as Grindr, TV shows, one person indicated, television commercials. So this can reflect on how, community-based organizations should conduct outreach when targeting populations that are at risk or have behaviors that put them at risk of acquiring HIV. Okay, and then I had another item that just asked whether they were on daily or on-demand PrEP, and a majority of the participants indicated that they were not on PrEP. So 80% of the 49% participants indicated that. And when you look at the gender breakdown, it's still consistent. A majority of the participants, regardless of gender, indicated that they were not on PrEP, with 91% of gender non-binary individuals, 81% of MSM, and the 2 transgender women also indicated that they were not on PrEP. Okay, so if participants answered no to not being on PrEP, they moved on to the next section, which examined the reasons for the non-uptake of PrEP. And I had technically 3 categories. One was examining individual reasons for things, so things that were in their control, and then social, cultural, or structural reasons, so things that are out of their hands, and then another item measuring other reasons, which I will discuss in the next slide. So for individual reasons, well, before I start, let me just describe the categories. So there was one category not at risk, which is pretty straightforward. Individuals don't possess behaviors that would put them at risk of, at least perceived behaviors that wouldn't put them at risk of acquiring HIV. Medication non-adherence, whether they believe that they would stick with a regimen, and perceived side effects, whether they believe that they'd experience idiosyncratic adverse drug reactions to taking PrEP, due to various reasons, such as maybe they have a health condition. And then for the social, cultural, or structural reasons, I have listed anti-LGBT, LGBT plus discrimination. It's not. I mean, it's very, very known that queer people face discrimination in all aspects of life, and healthcare isn't any different. Then confidentiality concerns, and this just encompasses, if they're a minor or they're on their parents' insurance plans, so they feel like their privacy may be invaded. They'll live in a rural, remote area, pretty straightforward. The stigma towards PrEP use. I decided to put that one in because I was reading several studies that indicated that One reason for the non-uptake of PrEP was because of this concept known as Truvada horrors. So essentially, individuals associate that with promiscuity if they know that someone's on PrEP, and as well as HIV stigma associated with the medication. Then the financial costs, pretty straightforward, and the lack of PrEP providers. As I discussed, 1 in 3 doctors and nurses aren't aware of what PrEP is. So the most common individual reason was people not considering themselves not at risk of acquiring HIV, then followed by medication non-adherence and perceived side effects. A majority of participants actually indicated that they did not consider themselves at risk of acquiring HIV. I'll discuss this further in my next slide. And the most common structural reason as to why individuals were not on PrEP was the financial cost of the medication, which is consistent with other literature that has suggested that the cost has always been a main contributor to whether individuals would uptake PrEP. Then followed by lack of PrEP providers, then stigma towards PrEP use and anti-LGBT plus discrimination, and followed by confidentiality concerns and living in a rural remote area. So other reasons for the non-uptake of PrEP. So some common themes that I noticed when I was interpreting the qualitative data, I noticed that there was 2 themes: general lack of consumer awareness regarding PrEP, and then some individuals indicated that they discontinued the use of PrEP. So some example quotes of a lack of consumer awareness are listed down below. One participant indicated they just simply don't know where to get it. Another one indicated that I just never really looked deeply into taking it. Excuse me. And then for the discontinued use, examples of that, a majority of them discontinued the use, suggesting that it was because the novel coronavirus, it impacted their sexual habits, so that's why they stopped taking PrEP. But one participant indicated that usually I take PrEP, but since quarantine and not engaging in casual sex, I have stopped for now. So those were the other reasons for the non-uptake of PrEP. I won't necessarily focus too much on, individuals discontinuing use because of coronavirus, just because that isn't necessarily a structural barrier, but the general lack of consumer awareness is something that should be addressed by community-based organizations as well. Okay, so on to the discussion. A majority of the respondents were aware of PrEP's existence, and a majority of those also possessed a basic understanding of the overall purpose of PrEP, which is to reduce HIV infection. A majority of the respondents also indicated that they were not on PrEP, with the most common reason, individual reason being that they did not consider themselves at risk of contracting HIV. So then this brings up the issue of whether individuals are truly cognizant of what behaviors may pose a potential risk in acquiring HIV. And I'll discuss this further when it comes to what community-based organizations can do to address this issue. Because I just found it really, I was surprised that a majority of individuals did not consider themselves at a risk of acquiring HIV. But as I said, not every MSM has to be on PrEP, and then my sample size was relatively small, and I took an inductive approach, so I really can't infer anything about it. But it just, nonetheless, it still surprised me. The most common structural reason as to why individuals were not on PrEP was the financial cost of PrEP. And then this one, there's individual and as well structural reasons, at least that I believe. As I said, California has made great strides in improving access to PrEP, such as Medi-Cal covering the entire cost of PrEP. If individuals don't qualify for Medi-Cal and are low income, there's PrEP AP. There's also was a new Senate bill that was enacted that now allows pharmacists to prescribe a minimum of 30-day to a maximum of 60-day supply of PrEP. So that also will increase access to accessing PrEP, and Medi-Cal will also cover that as well. For private for those who have private insurance, I'm not too familiar of how they can access it, but as I was doing my research, I noticed that there was a new bill introduced into the U.S. Senate known as the PrEP Access and Coverage Act that will require all private insurance companies to cover the entire cost of PrEP with no copays or out-of-pocket costs. So there's increasing initiatives and policies that are trying to curb the HIV epidemic. And it's up to community-based organizations to disseminate this information to community members, but as well as individuals being proactive in their own sexual health and overall health. They have to be, conscious of their own bodies and do the research as well, because sometimes, there are social cultural barriers such as, queer phobia in healthcare, where they may be faced with hostility. So that this is where they can have some agency over their own health and body by, researching these kinds of materials and policies. Okay, so some recommendations. So I have five recommendations that community-based organizations can do. The first one is community HIV screening. This can be done, just by screening individuals at a non-clinical office, and then providing them with oral swabs to test for HIV that they can do at home or at the facility. And this would be beneficial, especially since, let's say for those who are on public insurance, right, there is a long wait time to see a provider. Maybe some individuals don't feel comfortable seeing a doctor because, that person may not look like them, or, or agree with their identity. So, having a community-based organization that is primarily queer, right, would be beneficial in, curbing the HIV epidemic as well. And then there's sexual health promotion, which is just promoting, sexual well-being, making individuals, allowing individuals to be autonomous over their own body, making decisions for themselves, providing them with sexual health education and resources. And then there's harm reduction approach. There was a topic that I actually wanted to discuss further, but obviously due to time and resource constraints, I wasn't able to. But MSM in gay and bisexual, in the gay and bisexual community, there's I guess, I wouldn't say subculture, but like there's these group of people that engage in party and play, where individuals have sex and also do drugs. And as you know how I mentioned, 5% of individuals in Fresno County, 5% were of MSM who inject drugs. So this is where PrEP would be extremely beneficial to introduce to them, since that would curb HIV infections among these groups, since this group, since they're extremely vulnerable to HIV infection, because one, they're engaging in with multiple sexual partners, and as well as taking drugs. So this is where PrEP would be a useful harm reduction strategy. So that's also something to notice too, or to note too. I also want to note that I think it's also important for us to stop, or community-based organizations as well, to stop shaming individuals for their sexual behaviors, since oftentimes we're so quick to pathologize behaviors without really contextualizing why individuals do it. And I'll discuss this now with the healing-centered engagement, which the overall purpose is to promote individual and collective well-being, promotes political awareness and social action. And as I said, queer people have experienced systemic oppression, and which has created these conditions and where trauma is allowed to flourish. And in these traumas, they manifest in maladaptive behaviors. So instead of pathologizing these behaviors, it's important to address the root cause of why these individuals engage in these practices. So through healing-centered engagement and harm reduction approach, you're able to truly promote collective well-being, and not just focus solely on the individual experience. So I think that's important for community-based organizations to do, since in my opinion, I noticed that community HIV screening, sexual health promotion, and those two main ones, they're practiced commonly already, but not many individuals take a harm reduction approach. Many organizations and clinicians still shame individuals for their behaviors. And if you're shaming and being judgmental of somebody, do you really think those individuals are going to seek out help from you? So I think that's important for community-based organizations to adopt. And lastly, I think it's important for HIV research and prevention efforts to be more inclusive. As I said, most efforts are focused on gay men and bisexual men, cisgender gay and bisexual men, and they don't face the same barriers that transgender women and gender non-binary individuals experience. So it's super important to be inclusive of those two identities, or just actually all queer identities as well. And since, you know, oftentimes when we talk about queer struggle, it's always focusing on gay and bisexual men. You know, when there's, you know, queer women who experience additional barriers, you know, transgender folks and gender non-binary folks. So it's important for, you know, to stop singling out just one identity and focusing on that one, and being inclusive of other identities as well, since they're disproportionately impacted by, you know, at least transgender women and gender non-binary individuals are disproportionately burdened by the HIV epidemic as well. Okay, then going on to my outreach project. So this is conceptual, obviously, you know, due to time constraints and resource constraints. But in my, you know, this is what I kind of envision. It's a concrete program where there's discussion groups that are facilitated by queer identities that were mentioned. So, you know, they're gay, bisexual men, transgender women, gender non-binary individuals, right? They lead these groups because I think it's important for, oh, I'm sorry, gassing. I think it's important for individuals to see themselves reflected by, you know, reflected in those who are serving them, right? It's always nice to see someone who looks like you know, helping you out. And I also think it's important to emphasize healing-centered approaches, and in also incorporating discussion-based sexual health education, where there's an emphasis on identifying and educating on behaviors that pose a risk at acquiring HIV. Because I'm still surprised that many individuals indicate that they do not consider themselves at risk of acquiring HIV. That just really is, I'm still thinking about that. So I think that's a main focus of the discussion groups should be on. Additionally, also hosting workshops. An example of a workshop can be a PrEP provider facilitates a PrEP information session where they provide, you know, the basics of PrEP, right? From the mechanisms of action to side effects, potential side effects, and to other critical information regarding PrEP. And as well as client advocacy. I think this one's one of the more important ones, since this can decrease barriers to accessing PrEP. You know, so referrals out to community resources such as PrEP providers. So referrals to community resources such as PrEP providers, and as well as offering case management, where caseworkers can help enroll participants in Medi-Cal or PrEP AP. So that's essentially the overall logistics of my outreach project. And hopefully one day I could administer or facilitate a group similar to this, because I feel like it's extremely needed here in the Central Valley, especially in Fresno County, since looking at those HIV statistics, you know, it's just really beneficial to have this, since there's not really many organizations doing this kind of work, at least a healing-centered and harm reduction approach to HIV prevention. And I think that is this last slide. Let's see. Here are my references, a lot of them. Okay, so I'll leave it open for any questions if there's any. You could type them up in the Q&A box, if I can pull it up. Okay, so how would you go about changing the perspectives of individuals who didn't believe they need PrEP or weren't at risk of acquiring HIV? That is a question. So this is more, so I really, there's a difference, because there's some individuals who are willing, you know, and are receptive to, you know, learning about their own sexual well-being, right? So, you know, the only thing you can do is provide them with all of the resources and sexual health education, and where they can make the best informed decision for themselves. So, you know, you ask the individual whether they believe, you know, you ask them of their sexual behaviors, right? If they're willing to share. And in this scenario, you would be, screening them and seeing like, oh, this is a red flag, this is a potential indicator that they would benefit from PrEP. So like, let's say an individual maybe isn't truly cognizant of, maybe let's say like individuals say, oh, I don't frequently engage in casual sex, right? But let's say I do have casual sex maybe like 3 times in a span of 6 months, right? Which doesn't seem like a lot, right? But he also notes that he doesn't use a condom during those sexual encounters. So just because he isn't having as much casual sex, he is not using a condom during sex, and let's say he's a bottom, right? Or he's the one receiving during sex, he's at greater risk of acquiring HIV just due to the nature of anal sex, where there's more, where tears are more likely to happen. So just providing individuals with education, right, and as well as the clinician or the facilitator, doing their part by identifying these behaviors that can potentially pose a risk in them of acquiring HIV. So that's one way you can kind of really educate individuals on whether they are at risk of acquiring HIV just by doing a screening of their sexual behaviors or other behaviors, because HIV isn't just limited to sex. If an individual injects drugs as well, then that's a huge indicator, especially if they share needles. That's another indicator of whether they'll benefit from PrEP. And for individuals just do not believe that they need PrEP, that's kind of difficult to answer, because if an individual is not willing to learn and be receptive of this information, then there's really not much you can do. You have to respect their autonomy and just provide resources to those who are willing to learn, right? Obviously, always have empathy for those individuals, but for those folks who just aren't willing, then there's not much you can do. You have to respect their autonomy and just hope the best for them. Okay, so another question is, do you think educating high school students about PrEP and PEP in their health class would be beneficial? I definitely do think it's important. PrEP is now, most of the campaigns are focused towards, gay men, bisexual men, transgender women, right? And they do benefit the most because, queer people have historically been disproportionately burdened by the HIV epidemic, but there's also other demographics that are affected as well. As I said, you can be a straight person and you can inject drugs, right? That individual will benefit from PrEP. And there's, as I was doing my research, I also noticed that the African-American demographic, the Black demographic as well, is at greater risk of acquiring HIV as well. And obviously because there's conditions and that have allowed, for these, for them to be disproportionately burdened by the HIV epidemic as well. So it's important, to also, this is where healing-centered engagement also comes in as well. Understanding the collective, the systemic root cause of trauma that has manifested in these behaviors is important, and curbing the HIV epidemic. So I think it's important to be inclusive when talking about, sexual health treatments, to include PrEP and PEP, because PrEP, is obviously for individuals who are at risk, right? And then PEP is for individuals who believe that they have acquired HIV. And if an individual finds themselves in a situation where they believe that their sexual health has been what's a good word, put at risk, right? Because someone lied to them about their status, right? Then they know, like, oh, I can go to the emergency room and then I can ask a provider, if I can be prescribed PrEP, and then PrEP would, there's a high efficacy in reducing HIV prevention as well. And I feel like PrEP isn't really discussed either, and that's another area of research. Another area that researchers can focus on as well. But I definitely do think PrEP and PEP should be taught in high school, because kids start having sex at an early age. They don't only need to hear when they're in college, right? It's crucial for them to have this information at a young age, just so they can make the best informed decisions for their sake, and as well as their sexual partner's sake as well. Okay, any more questions? Okay, so how does one go about acquiring a PrEP prescription? So if you have a primary care physician, right, that you routinely go to, that'd be the best way for you to get onto PrEP. And as I said, there's some clinicians who aren't aware of PrEP, and that's where you kind of have to navigate, and be proactive in your own health. So let's say if you're in a network of hospitals, right, or clinics, like let's say United Health Centers, ask to find a doctor that does prescribe PrEP. If you're uninsured, right, I really wish I had the information readily available, but one of my, I think it was David Budavong from Fresno Barrios Unido, he actually provided me with information of someone at the Fresno County Department of Public Health who can enroll you or refer you out to a PrEP provider as well. So there's, there you can go through your primary care physician, you can go to a community-based organization. I wish I had that information readily available now. That's essentially it. That's your best option. I really don't have any other information that I could provide to answer that, but hopefully that answered it. But your best bet would to go to your primary care physician. Okay. So any other questions? Okay, so do you think distrust of the US government, historical abusive practices from Western medical clinicians, and big pharma also create barriers to PrEP? Definitely, yes, yes, yes. There was actually, my initial purpose, my initial goal with this project was to kind of examine disparities among, Latinx, African, and Black MSM, because they're of the entire queer community, they're the ones who are disproportionately burdened by the HIV epidemic, and and it's because of racism as well. So I definitely do think distrust, of the U.S. government, Black individuals, indigenous individuals, they have huge distrust when it comes to the healthcare system, due to historical practices, like forced sterilization, the Tuskegee experiment, all of these, all of these just horrendous acts of, of racism against them, which definitely, has contributed to, the non-uptake of PrEP as well. And then one article that I reviewed, it was examining Black and Latinx, and a majority of the Black participants, Black MSM, noted that they just didn't feel comfortable, or they just didn't trust any new medication that came out to prevent HIV. So that was a main concern, and that's something that clinicians. Well, actually, this requires a systemic overhaul because you really can't reform a racist system, right? But that's going into another topic. But yeah, definitely racism has played a role. What else? Let's see. Big pharma, yes. The reason why there should be no reason why PrEP medication should be $1,000. It's just ridiculous. We live in the state of California where we're lucky enough to have greater access to resources to accessing PrEP. But compared to other states, like especially in the South, where there's higher incidences of HIV, and they don't have the same resources, and so they have to pay, or they have to deal with the $1,000 price tag. That's just ridiculous. And I could go on and talk about how it's it involves. I can just go on. It's systemic. Things need to change on the systemic level. But I don't want to be messy on this webinar, so I'll keep it PG. And but yeah, racism has definitely played a role. Big pharma definitely as well. Okay. Any other questions before I hand it back to Angie? Okay, so I don't think there's any more questions. So I'll just hand it back to Angie.
Yeah, thank you so much, Robert, and thank you for your wonderful presentation, and thank you for everybody in attendance tonight. So before we close out the night, I'd actually like to give you some space, Robert, to close us off and give us any last words.
Oh, okay, you're putting me on the spot. So I just want to thank everyone just for viewing or just listening to my presentation. Thank you so much. I hope you learned something about this. I really wish I had done a deductive approach with my experiment, but I'm able to draw conclusions regarding my findings, and I can incorporate this in some programs that I'm going to be in or going to participate in later on. But I'm just thankful for, just for everyone who, helped me with my entire process, Angie, those who shared my survey, those who took my survey, those who are watching my presentation. Thank you to all.
Thank you so much, Robert. Okay, well, that concludes our last presentation of Community Health Awareness Week. Thank you everyone for being in attendance tonight, and I hope you all stay safe and healthy moving forward. Take care, everyone, and good night.